For many, opioid pain medications are an effective and important part of pain management after an injury or surgery, or for chronic pain. But as we so often hear on the news, opioid pain meds can also lead to addiction. This doesn't mean that we should stop taking medications as necessary and as directed, but it does mean that we should be aware of the dangers. The line between using pain medication correctly and misusing it can be blurry. Sometimes people miss the warning signs that their medication use is becoming a problem instead of a solution. Here are some of the signs to watch out for. You find yourself obsessing about your medication, thinking about it, counting it, checking to be sure that it's available. You find yourself taking more of your medication than your doctor recommended, or taking it more frequently. You lie to people when they ask you about your medication use. You watch the clock, waiting for it to be time to take your medication, even if you're not in physical pain. You mix the medication with alcohol or other drugs. You run out of your prescription early. You take medication that isn't prescribed to you. You rely on your pain medication for emotional relief from loneliness, depression, anxiety, or other kinds of emotional distress. You put off taking your medication so you can justify taking a larger dose later on. You mislead your doctor or pharmacist to ensure that you continue to receive your prescription. You consider switching doctors to ensure you can receive or increase your prescription. You feel defensive or angry when someone mentions your pain medication. You take your medication in a way it's not intended, like crushing your pills instead of swallowing them. Any of these can be a sign that your use of pain medication may have begun to be a problem. You don't have to wait for it to get worse or to cause damage in your life before getting help. You can take the warning and get help now. Talk to your doctor and be honest about the ways you are using and thinking about your pain medication. For more information about opioid use, dependence, and addiction, visit us online at workithealth.com.